emergent today, I'll be doing glucometer and specimen collection. First, I would introduce myself to my patient. I'd say, hi, my name is George, I'll be a nurse today. I would identify my patient 2 ways and verify his identity. Okay. Privacy would be provided, and I would perform hand hygiene. And to start the procedure, I would put on clean gloves, because this is a clean technique. Okay, you would choose the spot that you're going to test, and once you have that chosen, you take an alcohol prep pad and swab the area. And let that dry. While that's drying, you would check your strip, make sure it's not expired. You would also check to make sure that the glucometer is coated properly. Okay, once it's turned, I can see it is coated properly and it's ready. The alcohol spot has dried. You then remove this, perform that, and collect the blood. Once you have that, you'll get your reading. In case of excess bleeding, you want to just take clean gauze and hold it and wipe the blood away. The gland site would go in a sharps container, and the rest of the stuff would go in a bio bag. The next thing I'm going to demonstrate is collecting urine. For this, usually we'll have a patient do it on their own. They'll go into the bathroom, make sure that the area is clean, and try to catch midstream. You can test this sample with one of these strips here for any kind of foreign bodies in it or anything else, and you would just take the strip out, test it, and compare the results against the bottle. In order to withdraw urine on your own from a Foley, you would first find the port, and you would take a syringe, carefully uncap that. You could also alcohol swab the outside of the port, which you would insert it right in, withdraw the amount of urine that you would need, and it can be placed in the container. Once you have the container, it needs to be used within 20 minutes, or if it's longer than an hour, it needs to be put in a fridge. You would label the container with the patient's name, date of birth, room number, the time and date it was collected, and the doctor's name too. The last thing I'll demonstrate is the sputum collection. You would have the patient sitting up as upright as they can be. You would tell them to cough and deep breathe a few times until they feel the sputum ready to come out. And you would use a clean container, and you would have them cough right into the container, catching the sputum. Same principles apply. You would mark it with the patient's name, date of birth, time, date it was collected, doctor's name, room number, etc., and you would have that shipped off for testing.